Hello, welcome to the Sports Medicine Athletic Trainer YouTube page. Today we'll be demonstrating FABER and FADIR tests. First, the FABER test. The athlete or patient is supine. The affected leg is placed in a figure 4 position, the hip flexed, abducted, and placed into external rotation. The examiner stabilizes the contralateral ASIS and places a light posterior and abduction force through the ipsilateral knee until end range is felt. FABER can also be used to assess flexibility of the groin muscles. Small amplitude oscillations can also be applied at end range to assess for pain provocation at end range. A positive test is pain. This test can be used to indicate a number of conditions and injuries. Pain can be felt in multiple places. Pain felt at the SI joint could be SI joint dysfunction or sacroiliitis. Pain felt in the groin could be iliopsoas strain or bursitis, hip impingement, labral tear, loose bodies, chondral lesion, or osteoarthritis. Pain felt in the posterior hip could be posterior hip impingement. Next, the FADIR test. The athlete or patient is supine. The examiner grabs the affected leg and bends the knee while moving the hip into flexion. The examiner then combines adduction with internal rotation of the hip. A positive test is pain at the groin, a reproduction of symptoms with or without a click, or apprehension. In clinical practice, a negative FADIR test can effectively rule out femoral acetabular impingement, but a combination of anterior impingement test and passive hip range of motion and external rotation with the hip in neutral is needed for diagnostic purposes. Thanks for watching.